Welcome to our 5 on 5. I'm joined today by U.S. Senator Ron Wyden in studio. Senator, thank you so much for joining us today.
Thanks for having me.
So you met with a group of local leaders today to discuss mental health in the wake of COVID, wildfires, smoke. What did you take away from that meeting?
What I can tell you, Craig, is mental health needs are just shooting through the roof. For example, this morning I was at Asante. I met with these incredibly courageous doctors and nurses up there in the ICU. They're just out on their feet. They're working 12, 14, sometimes 16-hour days, and it just takes an enormous physical and mental toll. And we talked about some of the innovative approaches that are going to be pursued in Jackson County. And Senator Mike Crapo, he's a Republican senator from Idaho, the senior Republican on the Finance Committee I chair. We're going to have legislation this fall.
Many of the fires we've seen in Southern Oregon and Northern California this summer have burned on federal forest land. What are you doing to prevent the Rogue Valley from being blanketed in smoke like this every summer?
These are not your grandfather's fires. They are bigger, they're more powerful, they're leaping over what are traditional fire breaks. And one of the areas I'm very pleased about is in the bipartisan infrastructure bill, my legislation to allow for more prescribed burns is on its way to becoming a law. You have industry people, environmentalists, scientists all saying that it makes sense in the cooler months to do carefully controlled burns, and that prevents some fires during the very hot season. Made a huge difference in Sisters, that big fire. A lot of experts say it saved the town.
President Biden is taking more steps to mandate healthcare workers, and now Governor Brown is requiring teachers in Oregon to get vaccinated. Do you think government should be involved in medical decisions?
I always want to make sure that people can have their own individual choice. But it is clear masking works. Vaccinations make a big difference. And what I want to do is particularly make sure that folks who aren't vaccinated get a chance to have their questions answered. And I think it's so important that people wear those masks and get vaccinated.
As you know, here in Southern Oregon, our hospitals are overflowing. Now the National Guard is helping. This part of the state has much lower vaccination rates than up north. Knowing that this COVID conversation is politically charged, what would be your message to your constituents here in Southern Oregon?
My message is getting masked and getting vaccinated makes a huge difference. And when you talk to those incredible healthcare professionals that I saw today at Asante, yesterday in Bend, they're all trying to get the word out. I just got off the phone with the FEMA administrator, the emergency services administrator. We've got to get more nurses. We've got to get more personnel here to Southern Oregon. Get it quickly. I'm pulling out all the stops as a senior Democrat on the Finance Committee to get that help for Southern Oregon.
We're going to take a quick commercial break. Stay with us. We'll be right back. Welcome back to our 5 on 5. Again, we're here with U.S. Senator Ron Wyden. Senator, how do you think President Biden has handled our departure from Afghanistan, and what would you have done differently?
First of all, once Mike Pompeo and Donald Trump, in effect, negotiated the terms of surrender, we were faced with a very difficult situation. And I've been talking to a lot of parents, a lot of families. They didn't want to see hundreds of thousands of soldiers go back into Afghanistan with a no end in sight strategy. So certainly there are issues that have developed with respect to implementation. Today, I and others took steps to make it clear that we want to help get everybody out of Afghanistan ASAP. And as the son of parents who fled Hitler, I know better than most what it's like to have the refugee experience, and Oregon wants to be there for those refugees.
Do you think we should be increasing the amount of refugees we're bringing into our country in light of what's happened this week in Afghanistan?
We clearly have to step up. That's what dealing with refugees has always been all about. And as I say, in the case of my parents, I'm the son of refugees. As soon as my dad got to this country, he made sure he knew English. He worked for our army. He dropped the propaganda pamphlets on the Nazis, and now he's in the Holocaust Museum being recognized for all he did to help our troops defeat Hitler.
We have to talk about this massive infrastructure bill. You voted for it in the Senate. How does it benefit Oregon?
It's hugely helpful in terms of roads and airports. We got a lot of help for, I mentioned, prescribed fire. We have an opportunity to go in there and clean out those overstocked timber stands. It was bipartisan. And now it's physical infrastructure. We also have to work now on human needs. For example, something that everybody cares about in Southern Oregon is lowering prescription drug prices. I'm going to be leading that fight as chair of the Senate Finance Committee. We start with Medicare being able to negotiate to hold down the cost of medicine. Once Medicare gets that power, we're going to see prices go down in the private sector as well.
One final question. This week you announced a new bill to end homelessness and ensure affordable housing for all. How would that work and how would it be paid for?
We need a 21st century housing policy. We've got so many folks falling between the cracks. I mean, we see right here in Southern Oregon when the region got hit so seriously by the fires, we needed both emergency housing and we need tools for the future. What my legislation is going to do, it's called the DASH Act. Decent, affordable, safe housing for all. We're going to make a start first by making sure that homeless kids have a roof over their heads. Then we're going to have low-income housing tax credits, and I'm going to expand it to middle-income housing tax credits. So if you have a nurse and a firefighter, for example, they're going to have a chance to get decent shelter.
Senator, thank you so much for joining us
Thanks
today.
for having me.
We'll be right back.